Equine health is our business. Horses and education are our passion.
Welcome to the EquiConnect podcast. Here we have case-based conversation and talk about interesting news and information with the goal of sharing knowledge, focusing on equine health.
This podcast is not a substitute for regular and emergency veterinary care. Our purpose is to inform and educate horse people, not to diagnose and treat medical conditions without a valid veterinary client-patient relationship.
Hi, and welcome to the latest episode of EquiConnect, the McKee Pownall Equine Services podcast. I'm your host, Dr. Mike Pownall, and I am so excited that McKee Pownall is introducing a brand new service for our clients, and let's start talking about it. So we have Marnie Raymond. Marnie, how are you?
Good, thanks. How are you?
I'm doing great. So for the past few years, Marnie has been working with us as a body worker. So maybe perhaps Marnie can tell what we've been doing, what you've been doing within McKee Pownall.
Up till this point, it's been massage therapy, taping, physiotaping, and we use the PEMF machine as well as the Beamer blanket.
So, working within the team, within the McKee Pownall team, part of the vet team. And so, but you have spent the last, 4 years? Four years traveling almost monthly, and you have another tool on your tool belt, and you're now offering osteopathy.
I am now an EDO, an Equine Diplomat of Osteopathy. I'm super excited.
That is pretty cool. And as well, we are also joined by Dr. Kate Robinson from our Caledon location as we continue our discussion about osteopathy. So thanks for joining us, Kate.
Thanks for having me.
Okay, Marnie, the tough question. Let's start right at the beginning. What is osteopathy?
Yeah, we hear it all the time. So, it's slowly making its way over here to Canada. By definition, it's a manual therapy. So we are using our hands, and we are literally taking human osteopathy, but applying it to the anatomical and physiological needs of the horse. So we work on three systems primarily. So we work on the parietal system, which is your musculoskeletal system. We work on the cranial sacral system, so the connection from the cranium to the sacrum via the dural tube. So all your cerebrospinal fluid and how it nourishes the body. And we work on the visceral system, so all of the organs. So by looking at all three of those things, it's a real full body, whole horse approach. What we do is we manually mobilize. The whole thing is to bring mobility back to the body. And in doing that, we give the horses like innate healing ability to bring the body back into homeostasis. That's our goal. Bring the body back into homeostasis.
You invested a lot of time to do this. Like wasn't an online course. I mean, you were flying. I remember you were flying through COVID when nobody else was flying. You were flying about 8 times a year to the States for this course. So
I probably had more fecal swabs than anybody should have to have had in order to do this course. Yes,
badge of honor. So, I mean, to be this committed, you had to be super interested. So what developed your interest in osteopathy?
To be fair, I had looked at this course probably 10, 12 years ago, and it just wasn't accessible to me at the time. I was grooming full time. Like, anybody who's done it knows it's a 8-day-a-week job. But I also knew that, my whole career as a massage therapist, that there was something else I was looking for. And this desire to learn is always there too. So it just kind of, progressed. And then COVID came and I had 2 small kids and a family and a full-time job. And it just felt like a better time. Does that make any sense at all? No. It's I don't know how that was a better time than when I was a groom, but here we are. 4 years later, I got it done. So
tell us about the course you did, and because we were talking about it was long, but tell us about the course.
Yeah, so I went to the Vluggan Institute of Equine Osteopathy and Education. So the main school is in Germany, and then at the time, the school in the U.S. was in Texas, and then in my last year, it actually moved to Florida. So, it's back and forth for 4 years, studying in the meantime, and literally every extra minute that I had, every vacation I went on, my stuff came with me, and it was a really fulfilling, but really challenging time. I will say, like the first day you go to school, I remember sitting there and they're all of a sudden they're teaching us in Latin, and I was like, "What have I done? What is happening?" But then our teacher came in the next day, Yannick Vluggan, and he's just this like wealth of knowledge, and they'll tell you it's like drinking from a fire hose for 4 years, and it really is, but you don't, at the end of the week, you don't want to leave and you want more, which is really great. But at the same time, it's so much information. It's daunting. It's a weird experience, to be honest with you. It's, it's fulfilling and horrifying all at the same time.
I mean, I just, as an aside though, I mean, this was, and I just knowing how involved you were, this was pretty intense.
Very intense.
And so I guess this would be considered like the gold standard in training for osteopathy.
Yeah, so the Vluggan Institute is, it's at this point the only animal osteopathy school that is recognized by the IREO. So that's the International Registrar of Equine Osteopaths. So the IREO is actually who gives us our final examination. It's third party. The Vluggan Institute does not do it. And then once we graduate, we are allowed to call ourselves EDOs. So only people who graduate, having taken the exam from the IREO, can actually call themselves an EDO, which is great. I tell everybody now, I just want to be called Marnie, EDO. Thanks for asking. Worked hard for that.
Yeah, no kidding. No kidding. So, Kate, you had some training too. So, tell us about the training that you had at this institute.
Yeah, so I just did a 1 week, essentially I did the visceral module. That was December 2022, I believe. And that was to be able to pair up with Marnie's work, as well as some of the other osteopaths in the area that we work with. The visceral work that Marnie has already mentioned, there's a portion of that is accessed through rectal exams. So similar to how we perform a colic exam or a traditional repro check on a mare, we access and treat some of the viscera through that route. And EDOs learn about this, are taught how to do it, but because of veterinary bylaws being what they are in most states and provinces, they are not legally allowed to perform those types of exams on animals that they do not own, whereas veterinarians are. So the gold standard put out by the Vluggan Institute is that their EDOs have a veterinarian that has done this week of visceral training at the institute, and then can pair up and perform those internal, or what we have come to call pelvic room exams, with an osteopath when they have determined that such an exam is required or would benefit the horse.
I'm going to ask both of you this question because you both have two different perspectives on this. So, Marnie, when we talk about equine osteopathy, you talked about the three main systems that you're looking at. So, compared to other modalities that you're familiar with, and Kate, you're also a trained equine spinal manipulation specialist. What would be the purpose of equine osteopathy versus all the other tools that you have in your toolkit? We'll start with you, Marnie.
Even as a massage therapist, it just wasn't enough, and I wanted more. And that's not to say that massage therapy isn't enough. It just wasn't enough for me. I had this need to do more and to understand the horse more. And so osteopathy for me gave me this, again, you hear it a lot when we talk about osteopathy, or osteopaths talk about osteopathy, is this, it's the whole horse. We're not focusing on one thing specifically. For us to properly treat a body osteopathically, we have to look at everything. And I mean everything. The viscera is something that other body workers, and I'm not saying all, but don't really, not they don't consider it, but they don't work on it. And to be fair, legally, like we were saying, they can't. So this is kind of in doing this course and then having the ability to have had Kate go and do the module and to be able to work together is, I mean, how great is that? I don't even know how to, like, we can do so much now for them in this whole horse way that it's just, I don't know, just feeds something in me. I'm super excited about it.
So how about you, Kate? I mean, with this added tool, I mean, you're already an excellent, lameness vet, you're board certified in equine practice, like you've got a lot of credentials. So what does adding this to your toolbox mean for you?
Well, I mean, just from a learning and skills perspective, it was quite eye-opening. For example, just realizing that not only can I palpate organs and parts of the horse that you're told in vet school you can't, I can actually manipulate them as well. So if I find that the diaphragmatic cruise on the right side is feeling a little bit tight and restricted and we're getting a pain response on the horse, I can go in and actually use myofascial release techniques from the inside, and sometimes with Marnie's aid on the outside, we can get that essentially fascial or muscle knot to release. And I'm not aware of any other techniques that really allow us to do that. So, yeah, that in and of itself, just has been just an amazing thing to be able to learn about and experience. As Marnie was saying, like obviously she's much more aware and using sort of this whole horse approach, but it's really, I was already heading that way, and it's really helped push me that way even further. The systems of the horse do not act in isolation, and um, we're probably doing the horse a disservice if we try and treat them that way. Not that things that only focus on one part are bad, like chiropractic care or performing joint injections. Obviously, I'm kind of thinking of more like lameness performance type work here. But I think having something that we can access that allows this whole horse approach is just, it's so much more encompassing and is going to be overall more beneficial for the horse. And I think we will see longer lasting results for the horses that undergo this kind of treatment versus if we only, treat one thing that may be the main problem, but we don't acknowledge that that one thing leads to a dozen other things that are also affecting the horse. The example that I use all the time, and I have for years, it's not just a good example for osteopathy, but if you hurt your knee, you change the way that you are walking, and that then leads you to be leaning a little bit, and your low back starts to hurt, and then your ankle starts to hurt, and there's this sort of cascading effect. And I think certainly across equine medicine, and I think just medicine as a whole, whether we're talking about dogs, cats, or humans, we've been really bad about just what's the primary problem and let's treat that, and the rest of it we don't even think about sometimes, right? And so this is taking a very different approach recognizing that primary problem, treating that primary problem, but then also addressing all the other bits that come along with that.
In osteopathy, we're almost taught the opposite. Ignore the pathology and figure out what's happening that's,
Follow the
leading
pattern.
us to this. Yeah, it's just we're almost taught backwards from each other.
Well, this resonates because I know, I was a farrier, full-time farrier before I went to vet school, and I continued on as a farrier when we started the practice till I blew out my knee. And as you said, the hip starts to hurt and the ankle starts to hurt. So, but it was sort of like, it was that realization when I was a vet that, oh yeah, that foot's associated with the leg, that's associated with the body. And it opened up my mind so much to know that, well, when you see a horse that does this kind of wear on the shoe, there are other reasons that are causing it. Like, and as a farrier, there's only so much I can do unless we start to address the, causing agent wherever it is. It could be in the back end or what have you. And it's just, that's what I love about this stuff, because there's just so many cool things that are connected. So, so I guess my next question would be like, when is osteopathy recommended for horses? And I'm kind of thinking the both of you are going to say all the time.
Right. Yeah.
But what are the common, when you see a horse, so we'll ask both of you separately, when would you recommend osteopathy? We'll start with you, Marnie.
The list is long and never ending. Behavioral changes, not being able to pick up leads. All of a sudden your horse is, bucking or rearing and uncomfortable. It's the bits, it's grabbing onto the bit, or it feels weird. It's got a head tilt, or, overall it just feels a bit sore. These kind of mystery lamenesses, not really lame, but doesn't feel right. But lower back pain, or those pains that come back all the time, no matter what you do. So we got to dig deeper than, okay, the lumbar is an issue. So, anything really.
Anything to add to that, Kate?
Going back to what I was saying earlier, it doesn't mean that I'm not still going to inject hocks, perform mesotherapy, do
You still have to
horses'
treat those
teeth.
areas. Yeah.
Yeah, but then I can also say, I think your horse would benefit from this in addition, because it's going to just strengthen, I guess, the ability of that pointed treatment to do a better job of benefiting the horse, if that makes sense.
I don't know how you can do osteopathy without veterinary work, and vice versa. Like, if you really want the best care.
And that was my question, is I just want to make sure we're clear on it. So Kate's not involved with every appointment, right? With you, Marnie, or just there's select ones where you've identified that this visceral manipulation would be helpful, and that's where Kate comes in. Okay. Just as you were talking about conditions that might welcome osteopathy, I was thinking that horses that are recovering from an injury would find benefit. Because I know we've had horses that have been laid off for a colic, or they've had a tendon injury. To Kate's point earlier, horses, like people, we compensate. And though you've fixed one thing, you've had a bow tendon, for example, you fixed it, but over that period of time, other things have developed. So would osteopathy benefit the return to work horses?
Yeah, of course. We certainly have our own rules and ideas about when it's appropriate. Obviously, when there's heat or inflammation, or it hasn't been seen like a vet yet, I'm going to lay off, obviously. But as you start to feel better, we take it slow. We see what's working. We see what's going to help. And I think an important thing too is when a body's compensating because something's gone on, you have to be really careful when they're still in that state of compensation and they aren't feeling 100% yet. So you really have to take that into account, because we compensate for a reason. So
yeah, not all compensation is bad.
Yes. So you kind of have to, feel the horse out, work with whoever the vet is on the case, and always in mind that you don't want to make things worse.
Kate, you have talked about the visceral assessment manipulations. Define what viscera is, what you're able to palpate.
The organs of the abdomen. Obviously, I can't palpate everything. Horses are pretty big. But generally speaking, I will assess left kidney, the nephrosplenic space and ligament, the spleen, the ureters, the bladder, uh, uterus, ovaries, fallopian tubes in mares, inguinal rings, and then up in the ileocecal valve, kind of just coming off of the nose of the cecum, essentially, diaphragmatic cruise, uh,
A lot.
a lot. Yeah,
Whatever
Well,
she
but
lot.
can reach. Yeah.
but I did I get everything? I think that's everything.
I was sort of going through my mind as you were working your way around counterclockwise. Well, yeah, that's a lot. That's a lot. That's good.
My shoulders are sore.
So let's talk about an appointment. So how long is an appointment, and how frequently do horses need to be have appointments, Marnie?
So an appointment just with me, you're looking at, I mean, give or take, probably an hour and a half. I mean, it's hard to say.
So that's pretty intense evaluation.
Yeah, well, because so I'm literally going to flex and test every joint from head to tail. I mark down on my notes kind of biomechanically where things are sitting, what needs to be addressed, and then I will go back after and restore mobility to those joints. So it takes a minute. And some of these joints hurt and it takes some time. But for the most part, hour and a half. And then if we're doing a PRE for whatever reason,
What's a PRE?
That's the pelvic rim exam.
Okay.
With Dr. Robinson. I would say it's closer to about 3. Would you agree, Kate?
Yeah, and that includes an initial assessment with you, typically.
Yeah, so I'll assess the horse again when it comes in, just testing everything, and then it will be sedated and go to Kate for the pelvic rim exam. And then once the horse wakes up from sedation, I'll kind of mobilize any residual stuff that's left over.
So how do horses respond? Like this, I mean, this is a lot of time. If you're doing an hour and a half to 3 hours, how do you find horses accept it?
To be honest, it's really fascinating.
No.
Yeah, you want lies? Let me give it to you.
Please lie.
I think even more fascinating for me than the work that I'm doing is when you see, for example, when Kate's working on a diaphragm cruise and it's causing pain, when you can physically see how the horse changes its body shape when stuff like that is mobilized again, it's mind blowing. Like the comfort that you can, the whole body just kind of goes, oh, I've been fighting that for so long. I mean, you can't unsee it. It's fascinating. Yeah, I mean, I don't know, Kate, do you?
Well, they don't tolerate some of what I am doing very well, but they are pretty heavily sedated when we're working on them. And admittedly, that's why we are more like that 3-hour mark for the PREs, because often they're so heavily sedated for my part that they actually need to wake up a little bit before the osteopath can start working on them again.
Right. It's amazing. Just when you said that, I just remember before when I learned how to image pararectally with, a probe and look at the SI, sacroiliac joints and other structures. And sometimes you would palpate things. And we always think that pain is external on the, like the body, the legs, we can palpate it. It's its own world there too, because I have been, you've been sitting there palpating something and all of a sudden it's like, bang, like, don't touch that. You're like, oh, I was just sort of glancing over it. So that's a lead up to say that you're only examining them in stocks for your safety and the horse's safety.
Exactly. Yeah. And you also bring up another good point. I do ultrasound pretty much every one that we look at, assessing blood flow in the major arteries, in the sort of pelvic region, hindquarter region, low back. And then also I do take a chance to look at the SIs and the lumbosacral space. And we've had a few where we haven't found much on their PRE, but I have identified a really angry looking SI. And so we go ahead and we treat that instead, right? Or in addition to what we're doing. So the imaging part has been, I think, a really useful thing. And it's not something that was, we were taught to do it in the module, but not necessarily that we need to be doing it on every horse. I'm actually glad I'm doing it on every horse. I've learned a lot, and it's helped me be able to pivot on some of them.
Excellent. So when you do your first workup and assessment, on average, or what would a horse owner expect in terms of follow-ups? Is this a one and done as needed, or do you like to do a every so many weeks check for a certain amount of checks?
I do like to see every horse for a follow-up, especially if I don't know the horse. It just gives me an idea, but also I want to see if what I did held or if it's recurring, because if the same things keep showing up, that's going to tell me that I need to dig a bit deeper, and maybe the PRE is the way to go. So I mean, depending on how much I find on the first one, it will change whether I want to see that horse in 2 weeks or whether I think it's going to be 4 weeks. It's really kind of a case by case, but it's definitely like a follow up, and then you can kind of go from there as far as how often, and also how the horse responds. So
sure. I mean, they're the one that ultimately tells us that.
Yeah.
So the next question is a bit of a two-parter, and that is, I mean, you had a lot of tools in your body worker toolbox before. So what does having osteopathy add to that now?
It's changed my toolbox. It's so much bigger now. Well, it's changed. I mean, my toolbox really involves my hands more than anything. It always has. It's definitely changed how I feel things, how I look for things. I was good at palpating before. I'm going to admit I'm real great at palpating now. I feel a lot of stuff. So in that sense, I mean, my hands have only gotten better. I think sometimes now I have a hard time differentiating or separating massage therapy from osteopathy. I have a very hard time just going in and, let's say, massaging a horse, because my hands feel so much now. And I really love that whole horse approach too. So it's hard for me. I can't ignore what my hands find. So I don't know what that means for me for appointments in the future. We're trying to navigate this. It's new for everybody. But I trust my hands implicitly, and so I guess, I don't know, my toolbox is still what it used to be. They're just better. 2.0.
How about yourself, Kate? I said you've got all these, toolbox, your degree, a veterinarian, your chiropractic, your language skills. What does this add?
I think we've already said it, in that it's just allowed me to be better at looking at the whole horse and not thinking about problems in isolation necessarily. And it's just something that I can now say to an owner, hey, I think X, Y, Z, but let's also do this.
Right.
I also just say, from a colleague perspective, it's really fun to do them with Kate. We both bring something different to the table, so just being able to kind of talk about it afterwards, and honestly, it just feels really good to figure some stuff out, and then you have people call you and be like, oh my god, it's so much better. Like, how fulfilling is it on both our ends? We're
exactly. Well, I just
Exactly.
think the collaborative nature of this is so essential. And I think the more we can work together with other professionals, I think we just are better for the horse. And we all have distinct skill sets. And this leads me to my second to last question. So, Marnie, I know, just in conversations, it almost sounds like you're having an existential crisis because so much of your life was as a massage therapist, and now you have this. And so, how are you balancing the two? I know, like, just when I became a vet after being a farrier, I was like, oh, Mike, look above the coronary band, look above the coronary band, look above the knee. And there was a period of adaptation for a while to look at that whole horse. So how has this changed your body work or approach?
First, I'll say I'm not adapting very well. It's very stressful. Um, um,
Only because you care.
yes, because I want to do what's best. And
Yeah.
sometimes I know that's not necessarily massage now, or either way. Like, I can't be doing osteopathy on a horse and find a muscle that needs me and ignore it. Like, I think my practice will end up being an amalgamation of both because I don't know how to separate them.
Yeah. Well,
And
that makes sense. If you're looking at the whole horse, it's very similar to what Kate was talking
yeah,
about. You have all these skills, and it just makes you better at what you do because you have a
yeah,
bigger toolbox.
I can't. Yeah, you can't ignore things. I can't ignore things. So it's going to involve a lot of conversations with owners and figuring out, what we want to do and what's best. And it's going to be a learning curve, I think, for them and
Sure.
as we move forward.
Last question for both of you, and I'll start with you, Kate. So, in the week module that you did, and then the training you did, what was that light bulb moment, or what was there a particular lesson, session, whatever that you made you go, "Oh my gosh, I'm so glad I'm doing this. This is
Yeah.
amazing."
The light bulb moment, and again, it kind of goes back to everything we've been talking about, whole horse and not having things in isolation, was when Yannick said in his lecture, I think it was pretty early on the first day, about how a normal kidney on a human moves up and down about an inch with every breath that you take. And I was like, holy bleep, of course it does. But you don't think about organs moving, right? Or that they need to move to be healthy and help keep the rest of the body healthy. But yeah, the diaphragm goes up and down with breaths. The kidneys are sitting right underneath it. And if they're not moving, then that's probably going to have some negative downstream effect, because even if it's just in a very localized microenvironment, lack of movement is going to lead to decreased blood flow, edema formation, inflammation, et cetera, et cetera, et cetera. And so, yeah, him telling me, not reminding me, but telling me, teaching me that my kidneys and everybody else's kidneys need to move was just whoa. And that has just really, that's what opened up my brain to
Yeah.
this type of work, and has helped to guide conversations that I've had with clients, whether it be directly about osteopathy and maybe seeking that type of care, or just recognizing again our organs, our muscles, our fascia, all of our bits and our horses' bits are not in isolation, and we cannot think of them in isolation.
That was really well put. Movement is health, and so everything has got to be moving. And as you were talking, I was trying to feel if I can feel my left kidney moving as I was breathing. How about you, Marty? What was your aha moment?
So Kate, did one module. Imagine 14 of those when he's talking.
No.
And so every time you have aha moment after aha moment. But for me, because I'm such a hands-on person and I want to palpate things and I want to feel things, one of the craziest moments for me was when in the cranial sacral module. I think it's module 6. And so you can actually feel the cerebral spinal fluid move from head to tail and back. Yeah, I'll show you one day. And when
Wow.
and so when you don't know what you're looking for, you're like, I don't feel it. But once Yannick came over and puts his hands on yours and you actually feel it, you can't unfeel it anymore. And it's fascinating, and it's to be able to feel that. Or even he taught us how the motility of your liver and your stomach. I can put my hands on a horse and I can feel a liver and a stomach move, because I can get into the layer I want to get into. And to teach that and to feel it, it's just like, whoa, I can feeling a liver. It's
That's pretty
something
cool.
you feel. So once it's taught to you and you have these, so now these hands can feel so much more. And it's just, I think that for me was, I thought they knew things before, but now they really do know things. It's crazy.
That reminds me of the bad joke I always tell students, and they're always saying, "Oh, I want to play with, the digital X-ray or the digital ultrasound or the MRI or the CT and all this technology." And the best tool we have as equine practitioners are our fingers and feeling things.
Don't lose that.
That is the most important thing. I mean, it can tell you as much sometimes as any of these modalities.
Yeah. But temperature changes and heat,
Sometimes
it's
more.
fascinating.
Well, if you think on a level, like I was looking at a horse last week that we suspect has an abscess, and just the heat on the outside of the coronary band and was just incredibly hot. You're like, I'm pretty sure this is where it's going to burst out because that's where it's looking to. And so that's just one area of a not too subtle condition like an abscess. So imagine the nuance to feel the liver is pretty special.
Yeah, it really is. It never gets old either. Sometimes I just do it for fun.
Well, thank you both for joining. This is fascinating. And I know when clients get out to meet you, Marty, not only for your skill set and the body working and the osteopathy, but just your way around horses. I've just seen too many times myself really cranky horses sort of melt underneath your presence and influence. I think clients really will see the value of this. So thank you both very much.
Yeah, I can't wait, honestly. Let's do it.
Thank you. Yeah, we're really excited about it.
Okay, I'm just going to pause this for a second.
This podcast is not a substitute for regular and emergency veterinary care. Our purpose is to inform and educate horse people not to diagnose and treat medical conditions without a valid veterinary client-patient relationship.